On Tuesday, we did the 4 patient encounters, and overall, I think myself and my group did really well. I feel like we felt confident in the documentation skills, what questions to ask, and what kind of information we needed in order to come up with a prognosis in terms of actually going through the patients and knowing that each patient is different and you have to treat each kind of symptom differently and just getting different details and further questions with each patient. I felt like that was kind of interesting to go through and get that experience. In terms of the 4 patient encounters, I feel like we did the best with Jake and Casey. Those were our last 2 patients. And the first 2, we kind of learned that we need to ask more follow-up questions or more questions that led to follow-up questions in order to get further details. With Hannah, who was our first patient, I felt like we needed to learn or ask more questions about her involvement in sports, which could be causing her knee pain, or in terms of shoes, just different questions besides just her overall injury. With Jake and Casey, I feel like we did the best because we asked a lot more follow-up questions and getting more detail, which led to us feeling confident about what could be going on with them. In terms of Jake, I feel like we did the best because we asked specific questions about what was going on. We asked to do the palpations, we did bilateral palpations, and then we did specific things in order to figure out that it could be a potential spleen injury. But with Casey, I think it was also interesting because it was a non-orthopedic and we had to get more diet information, water consumption, urination kind of information. So that was definitely interesting to go through and get a different aspect of evaluations. Overall, I think our patient encounters went really well. For the future, I think just learning that the most detailed questions and getting the most information is the best way to get documentation and to figure out what is going on with the patient. And you kind of learn that through this experience, the more information you get does definitely give you a more clear answer to what could be potentially going on.